A very warm welcome to my channel at Doc Nature Lover. I hope you guys are having a great week so far. Today I will be talking about a story, a real story that I encounter almost every single day of my life. It's a fascinating journey and experience. It has been for the last 20 years where I have gained so many experiences and have learned so many stories. And the endpoints of these stories are sometimes very good, incredible, sometimes great. So let's hear one of those stories that I want to share with you guys, and you might be feeling in the same shoes as this story, this girl, 26-year-old, felt. She presented to the emergency room with stroke-like features. She was having tingling and paresthesias all over the left side of the body. She was having slurry speech. She presented to the emergency room. Of course, she had a CAT scan of the head done. Thereafter, she had an MRI of the head done, and nobody was able to figure out what the hell was going on. So, what is the next step? So the ER decided to have her do some blood test. Her blood work was unremarkable, and the patient was discharged saying that the patient was trying to be a hypochondriac. So the patient actually had nothing going on. This caused the patient to be very, very depressed. She started not going to her friend's house. She was feeling not good, and these symptoms that occurred had left her with a constant feeling is, why am I having these symptoms? So with these questions in mind, the patient's mom brought this patient to me. Yes, her mom being my patient, and I saw this patient several years back. But this story is so significant that it made an indelible print on my mind. Yes, the patient was telling me that, how she felt and how this occurred, and she had a stroke. However, they couldn't find anything in the brain. The MRI was negative. The blood work was absolutely normal. There was nothing that they could find out, and this was more of a puzzle. So I always believe in that clinicians should always take a very good history, and without any further conclusion, what I did was I tried getting a very good history from the patient. I came to know that about a year back, this patient had turned vegan. Yes, she used to give up pretty much everything, and she changed into vegan. So her diet changed, and that's exactly what you guys are thinking. Yes, the patient had severe B12 deficiency. The B12 deficiency is prevalent all over United States, all over the world. Patients above the age of 50 are highly susceptible to vitamin B12 deficiency, which caused by several reasons. And in this case, the patient decided to be vegan. And guess what? Vegans, they do not have enough supply of B12 in their diet. So I ordered a simple test, a B12 level in her blood, and it was critically low. The patient was reassured by me that she's going to get better. She's going to feel a lot better. She's not going to have problems concentration. Her memory is not going to be going away. She was thinking that this is the end of her life. Extremely tired. She hardly could have time for her family. She went to work, came back, and went straight to bed. She could not function. She couldn't do anything. So when she turned vegan, she had given up all of the meat products that she was eating, and there you go. Highest amount of B12 is present in clams. So clams have a whopping 84% per 3 ounces of clams, mcg of B12, followed by beef liver, which has around 71% mcg per 3 ounces, and then followed by salmon, which is my favorite food, trout, Again, my favorite food, milk and yogurt, which is my favorite food. I do not eat meat, but I do eat a lot of fish, and I love seafood. So those are some of the sources of vitamin B12 in our dietary needs. So if a person is eating ham, beef, it's no problem, the B12 is fine. However, if the patients are vegan, then they need other sources of B12, because B12 is present in certain kind of vegan sources, which is soy milk, plant-based milk, breakfast cereals fortified with vitamin B12, nutritional yeast, and of course, you know that if you are deficient in B12, then you have to take B12 supplementation. However, very interestingly, sometimes there could be a problem in the absorption of B12. So how does B12 get absorbed? B12 gets absorbed in the stomach with the help of a factor which is called intrinsic factor. And when the patients are developing antibodies, or they are developing fighters against the intrinsic factor, they develop what is called pernicious anemia. This patient was not anemic, however, her B12 was critically low. However, in a lot of patients, you will see they have very mild anemia, and when you check the B12, they will be very, very low. Usually B12 levels run somewhere between 200 mcg and 1100 mcg in the bloodstream. However, I have seen people who have less than 400, they usually have lots of symptoms of B12s, including pins and needle sensation, having memory. If you have any of the symptoms, please make sure you tell your doctor to check your B12 level. However, if the B12 level is normal, are you going to give up? No. You're going to tell your doctor to probably order a homocysteine level or methylmalonic level. Why that is? Because if the B12 is normal, however, if the homocysteine and the methylmalonic acid levels are high, then you also have a B12 deficiency. Yes, B12 deficiency has been linked with stroke. There was a huge study, it's called the Heart Outcome Prevention Study, in which they found that low levels of B12 were seen in patients who had stroke. So what's the reason? So basically, homocysteine goes up, which is an inflammatory marker. Anytime there is inflammation in the body, your body is going to go in a stroke mode. So you cannot have inflammation in the body. Usually these patients have very, very high levels of homocysteine or methylmalonic acid or MMA. I'm going to outline below the names. If you are having symptoms of pins and needles, if you are having headaches, I got a very good history from this patient that the patient was having significant amount of headaches. B12 deficiency causes headaches, and those will not go away with the help of migraine medications. So what's the solution? Well, there are quite a few solutions. B12 is present in quite a few foods. However, there is a lot of people who do not eat those foods. So for them, what to do? We need to supplement them. A very easy way of supplementing B12 is giving them an intramuscular injection. That injection can be given by the patient or the patient's family, or the patient could see you and get an injection. So usually, what's the regimen for the B12? There is not an exact regimen that is followed. It depends what the level of the B12 is. However, I've seen mostly 100 mcg every 6 to 7 days, given for a period of say 7 doses, and then followed by say every alternate day for another 7 days, followed by 3 to 4 days of vitamin B12 at 100 mcg, and then giving them once a month. And of course, you're going to check the level of B12. And what's the level of the B12 that you're looking for? You definitely want to go for the B12 level to be 600, 700, 800 and up. Usually patients who are students or have difficult jobs, they struggle with B12 deficiency. I'm telling you, in a day-to-day basis, I probably see so many young patients and elderly patients who are so much deficient in B12. Another big reason for that is for B12 absorption, you need hydrochloric acid. However, we are taking lots of medications. Guess what? Number one medication is PPI, Nexium, Acifex, Dexilant, all these acid reducers, what are they doing? They are preventing the B12 to be getting absorbed. So B12 doesn't get absorbed in them. In those patients, the only way is to give injections. There is a form by which you can give B12 through the nose. It's called Nascobal. As I said, this is not a sponsored video by any means. I'm just giving you information which I see on a day-to-day basis. And you also can take sublingual B12, a dosage of 5,000 milligrams when you are deficient, and you can even take 2,000 mcg per week even if you have normal levels of B12, to help your alertness, to decrease confusion, and to be more aware of what's going on. Also, when you get the B12 in the first 6 to 7 days, there is a significant difference in energy level. Patients also will be having less depression and less anxiety symptoms. Yes, you got me absolutely right. B12 deficiency causes increased amount of anxiety and depression. If you are suffering from anxiety and depression, please do not hesitate to talk to your doctor and ask, can I please have my B12 level checked? And go forward. I'm sure you will be able to find out a reason for your anxiety, depression, headache, because I see it in day-to-day life all the time. Young, old, every group of the patient, every patient population has B12 deficiency, because we are using a lot of other medications like Pepsid, which are H2 blockers or acid blockers. So if you do not have acid, the B12 is not going to get absorbed. So next time when you go to see your doctor, and if you're feeling tired, if you're feeling tingling, numbness, if you're feeling foggy in the morning, if you are feeling confused, you're not alert, you feel, oh my God, in the middle of the day, I cannot go any further, then definitely do not hesitate to ask this question, Doc, can I have my B12 level checked? I hope you enjoyed this story, and to keep on listening to a lot more stories, and these are real life stories. They are not made up stories. For 20 years I've been a clinician, and I love my profession, and I love helping people. But YouTube is some way in which I can reach to a larger audience, so I do not have to be restricted. My knowledge has to be restricted inside a small place. So I can get a lot of people feeling better, and that's the whole idea of my YouTube channel. If you like the content, please do not forget to subscribe to my channel. That will be very rude if you do not subscribe to my channel. I will be very, very, very offended. So please hit the bell icon, please subscribe to my channel, and if you like the video, give a thumbs up. If you did not like the video, give a thumbs down. And please write below, what do you think about the story, and what other stories or topics do you want me to talk about?